mynews.studio.
Under the desert's sun, Egypt has managed to erase hepatitis C from its map. Do you think this could change the way we look at global health?
The date today is November 18th, 2025. Egypt's story really stands out. Just 20 years ago, they had the highest hepatitis C infection rate in the world, about 10% of their population.
Exactly. And that epidemic wasn't linked to lifestyle factors, but mostly to unsafe medical practices from decades earlier. The numbers were so high, it almost overwhelmed their entire healthcare system.
The real shift began in 2018. Egypt's government launched the 100 Million Healthy Lives campaign. But I've always wondered, how did they manage to test almost every adult in the country?
They set up thousands of testing sites, community centers, mobile clinics, even schools. In a matter of months, over 60 million people were screened. And if someone tested positive, they could access direct-acting antiviral drugs, which were locally produced and cost under $50 per patient.
That's a crucial point, making the drugs locally. Most countries still depend on expensive imported treatments. By producing their own, Egypt cut costs dramatically and made treatment far more accessible. But getting people to show up for testing, how did they do that?
They focused on massive public awareness campaigns. The message was delivered from the highest levels, including government leaders. They presented hepatitis C as a problem people could overcome.
So, not something to be ashamed of, but a health issue everyone could talk about. Did that help reduce stigma?
It really did. When leaders talk openly and the media spreads the word, stigma drops. Egypt also trained healthcare workers to be supportive and non-judgmental. And to reach remote areas, they used telemedicine.
Telemedicine and mobile clinics, right? That must have made a big difference for people in rural areas who couldn't get to hospitals.
Absolutely. That was essential for reaching those communities.
Let's look at the numbers. By 2023, Egypt diagnosed 87% of people living with hepatitis C, treated 93% of them, and new infections dropped from 300 per 100,000 in 2014 to just 9 per 100,000 in 2022. Prevalence went from 10% to 0.38%. That's a big shift. Was that enough to satisfy the World Health Organization?
Yes, it was. The World Health Organization validated Egypt as the first country to reach its gold tier targets for hepatitis C elimination. It means Egypt is now on track to remove hepatitis C as a public health threat by 2030, or maybe even before then.
Funding such a huge campaign must have been a challenge. Where did the money come from?
Funding came from different sources: government budgets, international partners, and savings from making drugs locally. Keeping everything coordinated was tough, but Egypt's government kept a close grip on logistics and governance.
And for other countries, do you think they can follow Egypt's model, or is this a unique case?
The main framework is there: mass screening, low-cost treatment, strong political commitment. But each country will have to adapt the approach to their own situation. What matters most is leadership at the top and making care accessible to everyone.
So the takeaways: political leadership, local drug production, engaging communities, and working with international partners. Do you think those strategies can be scaled up in other places?
Yes, exactly. Egypt's now supporting neighboring countries with both expertise and affordable medication. That could have a big impact, especially in Africa and Asia.
Why is this important for the rest of the world? Hepatitis C still causes millions of infections and deaths worldwide. What Egypt did shows that even countries with limited resources can take on major epidemics and win.
What their campaign proves is that large-scale problems need coordinated action. If Egypt can do it, it raises the question, why not elsewhere?
That's really the crux of it. Egypt's story isn't only a medical achievement, it's a possible roadmap for others.
Thank you for joining us as we explored how Egypt ended hepatitis C and what that could mean for global health.
Stay curious, keep asking questions, and remember, change is always an option.
Thank you for listening. This episode was powered by mynews.studio. You can try it now for free.